I'd really like to thank you so much for being with us today. It's an honor and a great pleasure to be with you. My name is Khalil Al-Salem, and these are 10 simple advices that will help you maximize your Botox treatment. So, how does Botox work? This has been addressed well 2 days ago by Dr. Dalman, and we have a very beautiful, me and Dr. Tulhi, very beautiful course that we did in 2018. You're very welcome to see it on YouTube. So today I'll be more focusing on how to prevent complications during Botox treatment and what tips a surgeon can do in order to maximize his Botox outcome. So Botox is an anti-scarring agent. There's a lot of literature since 2017 talking about that, and the first to mention it was Shao and colleagues, who presented a study of 19 cases. Those patients had keloids and they were injected botulinum toxin inside the keloid, 2.5 international units per centimeter square of a keloid scar every month for 3 months, and then they assessed the results after 6 months of injection, and they found a very satisfactory outcome post keloid injection. So we took the idea and we started injecting botulinum toxin A following blepharoplasty, and usually the botulinum toxin is injected between 1 to 3 months after doing blepharoplasty. We started actually the study just before COVID in 2019, and we had some difficulty following up patients in the middle, so we did the study all over again in the late 2020 and 2021, and the study is expected to finish in a year time. We think that on short term there is a great deal of improvement. However, we are still waiting for the long-term pictures in order to assess whether any of the arms, whether you're giving Botox injection after blepharoplasty or not giving Botox injection after blepharoplasty, has a benefit. This is a patient whom we did blepharoplasty on. So you can see the difference between before and after, but she came actually complaining of a very small mass, like a very small dimple at the outer side of the eyelid. She wasn't very happy about, so we did for her plasma exeresis along with Botox injection, and you can see the tremendous improvement, and you can see that the dimple has disappeared and it was almost flat. This picture was taken around 2 months of doing plasma exeresis and treatment with Botox. This is another patient whom we also did blepharoplasty. This is the before and after picture. She still was unhappy about the 8 figure. She wanted more a roundish appearance of her eyelid. So we did for her plasma exeresis along with Botox injection at the outer side. So you can see that it helped in the patient in getting rid of the crow's feet, along with the giving her a more natural, or let's say roundish appearance of her eyelid. So timing to give Botox injection after cosmetic surgery, we believe it's best to be given 1 to 3 months after surgery. Site and dosing is the usual for cosmetic injections. We also injected the scar of direct brow lift, and we feel that it helped a lot those patients in having very minimal scar after surgery. And we attempted to inject those patients 6 weeks after surgery, and we gave them around 4 to 5 injections per site, each around 1 international unit given per site distributed all over the direct brow lift scar. I personally do not combine Botox injection with any other procedure. It's better to give, let's say, a space between any procedure that you are doing and Botox, because you don't want Botox to be dissipated by the edema caused by other procedures, whether it's blepharoplasty or plasmapheresis. This is a picture of a patient who did brow lift. This is her picture after 3 months of doing the brow lift. You can see that after giving Botox injection, things are really almost unnoticeable. She's very happy, and these are actually one of the patients who didn't have even redness or a hypertrophic scar after surgery. So the site of injection is is almost taught everywhere and in your course. Standard injection to the outer side of the orbit where orbicularis is weakened. At crow's feet, procerius is very important area to be injected. Corrugators. I personally do not inject a lot of Botox to frontalis. It's very important not to overload it with Botox, because this will cause the eyebrow to droop. So I personally don't give more 6 to 10 international units of Botox at the frontalis. This is a very important tip. It helps the patient to, let's say, get rid of the wrinkles, and still the eyebrow is dynamic and the patient can move his eyebrows. Another important tip is that I never inject those areas, area A and area B, which I see some of my colleagues, dermatology colleagues, actually injecting them. Especially at site A, where you have the inferior oblique. So God forbid, if you have a small leak of Botox to the inferior oblique, this will cause a chin up position and very bad double vision. Site B, well, it's always unpreferable unless you have a very great deal of experience to inject this area. This area, at this area, you might have some leak to the vetropalpebris superioris, causing a droopy lid. What is the correct position to inject Botox? Well, if you see here, your needle should be always be directed away from the eye. So the diffusion will be away from the eye. This is so important. So in this position, if you are injecting the procedures this way, this might cause some leak of material to either side of the eye, especially if the patient, for example, when was running, or she went into a hot bath or so, some of the material might leak into the orbit. Finally, allergies. Allergies are really problematic, and every one of us had at least 1 or 2 patients whom was giving botulinum toxin, and after that she had a very bad reaction, very bad allergy. This is a patient I did for her blepharoplasty. She was so happy. 3 months later, I recommended doing Botox injection, and actually she called me after I finished my office hours, like 4 hours later, and she was sent to the ER with this puffy face. So we gave her hydrocortisone along with antihistamine and mast cell stabilizer. Usually, in my hands, it takes between 2 weeks to 1 month for this condition to improve. However, in patients with blepharoplasty, I noticed that because of poor lymphatic drainage, this might take a little bit longer, around 3 months. And thank you so much for listening. These are my social media contact information. And thank you so much for taking your time. Thank you.